Welcome to Mind Mentor. In this video we will discuss about schizophrenia. It is a complex and severe mental disorder that affects how a person thinks, feels, and behaves. It can be a lifelong condition and often emerges in late adolescence or early adulthood. It's important to note that schizophrenia is not the same as multiple personality disorder, which is a different mental health condition. Here are some key characteristics and aspects of schizophrenia. 1. Symptoms. Schizophrenia is characterized by a range of symptoms that can be categorized into positive, negative, and cognitive symptoms. A. Positive symptoms. These are abnormal experiences or behaviors that are added to a person's usual way of functioning. They include hallucinations, false sensory perceptions, often auditory, delusions, false beliefs, disorganized thinking, and disorganized or abnormal motor behavior. B. Negative symptoms. These are deficits or reductions in normal emotional and behavioral functioning. Negative symptoms can include flat affect, reduced emotional expression, alogia, reduced speech output, anhedonia, inability to experience pleasure, avolition, lack of motivation, and social withdrawal. C. Cognitive symptoms. These involve difficulties with thinking processes, such as problems with attention, working memory, and executive function. Cognitive symptoms can significantly impact a person's ability to lead a fulfilling life. 2. Causes. The exact cause of schizophrenia is not known, but it is likely to result from a combination of genetic, environmental, and neurobiological factors. A family history of schizophrenia can increase the risk, as can certain prenatal and perinatal factors. Changes in brain structure and function, as well as imbalances in neurotransmitters, chemical messengers in the brain, are also associated with the disorder. 3. Diagnosis. Diagnosis is typically made by a mental health professional based on a thorough clinical assessment. This includes evaluating the presence and duration of specific symptoms and ruling out other possible causes. 4. Treatment. Schizophrenia is a chronic condition, but it can be managed with treatment. Treatment often includes a combination of the following. A. Antipsychotic medications. These drugs can help alleviate positive symptoms like hallucinations and delusions. Newer atypical antipsychotic medications are often preferred because they tend to have fewer side effects. B. Psychosocial interventions. Various types of therapy, such as cognitive behavioral therapy, CBT, family therapy, and social skills training, can help individuals cope with their symptoms and improve their social and occupational functioning. C. Supportive services. Individuals with schizophrenia may benefit from community support, vocational training, and assistance with daily living skills. 5. Prognosis. The course of schizophrenia can vary widely among individuals. Some people may experience one or a few episodes of psychosis and then recover, while others may have chronic and severe symptoms. Early intervention and treatment can improve the prognosis and quality of life for people with schizophrenia. It's essential for individuals with schizophrenia to have a strong support system, including mental health professionals, family, and friends. With the right treatment and support, many people with schizophrenia can lead meaningful and fulfilling lives. However, ongoing management and care are typically necessary. Thanks for watching. If you like our videos, please like and subscribe to our channel, Mind Mentor.